We have with us today Mr. Lucian Eon, a consultant plastic and cosmetic surgeon, to talk about our first topic of the show. Is it all about the breasts? It seems like we hear and see through the media celebrities all having boob jobs. Are we a society fascinated with breasts? I know I am. Anyway, thanks for coming in today, Mr. Eon.
Thanks for the invitation, Steve.
Great. I mean, on the topic of obviously breast implants, breast surgery, what are the typical patients that come in to see you?
Well, first of all, there are the younger women that feel they want to have fuller breasts, and the more common scenario, I think, these days would be patients that have had children, their mothers that want to regain their figure from pregnancy. They're active, they're often working, they want to feel that they have really gone past the shape they didn't like during their pregnancy. And it's quite an effort.
Yeah, I'm sure. Are people going bigger these days, or are they just wanting something which is more natural?
I think actually they have gone past that phase. I'm glad they did.
Yeah, that's right.
Obviously, the big fear is looking unnatural, although a small percentage will say, I actually like the fake look. I'm personally one that stays away from things that look unnatural.
Yeah, for sure. I mean, I think the media, they capture everything. You see so many celebrities with great boob jobs, but then others with not so good. So
I think the perception we would have is that if someone looks too good to be true, it's a good operation.
That's true.
If you start seeing telltale signs, you want to walk away.
Absolutely, absolutely. Well, I just want to show you some of the comments that we actually got from people in the street about breast surgery. What's your opinion on breast implants?
It's up to the individual, really.
If you want it, get it done.
I don't really like them because I don't like the fake look.
I like them.
I don't. They're too fake.
Yeah, no, I agree with it, definitely. I'd have it done if I had the money. Sometimes some people it's necessary if they have self-esteem problems and that kind of thing, but I personally think it's better to fake it.
It can go horribly wrong, so I don't know.
What do you girls think of cosmetic surgery?
Brilliant, because I've got small boobs and I need a boob job.
Obviously, there was a real mixture of comments there. I mean, I do find it quite funny how a lot of women in the UK will talk about how surgery can benefit others rather than themselves. I mean, talking on national television probably doesn't encourage them to, tell all. What's your thoughts on, people actually being open about having breast surgery?
I think most of the time girls would prefer to be the only ones to know.
Yeah.
And it's a very private thing for them. To some extent, I think they would be delighted even if their partners wouldn't know. But they will accept that this is not possible for the time being.
Yeah, of course.
And sometimes they feel that it's just one of those things and they're happy to discuss about it as if they discuss about trivial things about their life.
Yeah.
I think generally speaking it's a good idea if they treat it seriously, whether they want people to know or not.
For sure. I mean, we had an interesting email here. It was from Lisa Dowling from Manchester, and she said she's always been scared of obviously having cosmetic surgery. She's very interested in increasing her breast size, but she's asking, is there any alternatives to surgery or less invasive?
To formal surgery, to breast implant surgery, yes. The most well-known alternative is to use macrolane injections, hyaluronic acid injections, which can be done as an office procedure under local anesthetic, but they will not give a very significant volume increase. So if someone wants to increase by maybe 2 cup sizes, they won't be able to do that through macrolane.
Yeah.
And potentially also if they start very, very small. And then the other option, which is currently under a lot of scrutiny and people are interested to make sure that it is safe, is fat transfer. Fat transfer has been used by itself or enhanced with stem cell treatments. There's a fair amount of evidence supporting it, and it's used a lot for asymmetries and reconstructions. But for primary augmentations, there are still some reservations, and that's related to long-term safety for the women. Having said that, the data that's being collected is very encouraging so far.